So you've already told us that we have about, did you say 800 or 8,000 children?
800,000.
800,000
per annum.
Oh my goodness. So 800,000 children dying every year in Nigeria
At
from
minimum.
that's minimum. So it could be more.
Yes.
Wow. So and they're dying from diseases that could actually be prevented.
Yes.
So let's talk about why many people still do not take their children to get vaccinated against, some of these childhood killer diseases. Between ignorance, stubbornness, and maybe religious or cultural beliefs, which one would you say has the highest?
All.
All.
All. But in recent time, religious is now playing a major role. Most people now believe in what their pastor says. And they feel, my pastor is saying that, we are healed by this, we are healed by that, so don't go to the hospital. So based on that, they are not accessing care. And also some parents don't understand the importance of this vaccination. So that's where ignorance comes into. They don't understand that with vaccine, one, it saves cost. Because when the child is sick, you have to take the child to the hospital, you spend so much admission fee and everything. And eventually the child may even die from this preventable disease. So it saves costs, it saves the family from mourning, from death, and also it's helped the child to grow well and to be healthy. So due to ignorance, they don't understand all this. They don't go to the hospital. They feel, vaccine is going to, they only hear about the myths that people tell them, if you take your child for vaccination, the child may become an imbecile, the child may become this, the child may become that. So based on that, they will stay back and not take the child to the hospital. So ignorance too plays a major role.
So what are the childhood killer diseases? Let's talk to us about some of them that these vaccines can actually prevent.
Okay, I will start from the day a child is born.
All right.
We have BCG.
Okay.
And what does that BCG do? BCG prevents tuberculosis. So, we are in a place where tuberculosis is endemic. Prevalence of tuberculosis is quite high in Nigeria. And overcrowding and so many things. So a newborn is susceptible to that infection.
Okay.
So in order to prevent that, we vaccinate the child from day one. Before you even go home from the hospital, we give BCG.
Okay.
So to prevent tuberculosis. Then at 4 weeks, we give hepatitis and we also give polio. So that's to prevent hepatitis, to prevent polio. We also give measles vaccine. So measles is to prevent measles infection. And if that child eventually comes down with measles infection, it won't be severe.
Okay, because I was going to come to that as well.
It won't be severe at all. Then we also give injection for tetanus.
All right.
We also give for diphtheria. Recently we had rotavirus. It's been added to prevent diarrhea. So we also give injection for meningitis. We give for yellow fever. So many diseases that we can prevent and that are quite prevalent around here.
All right. So back to the question I said I was going to come to. People take the vaccines, right? And they're sure that their child took the vaccine. But then later on in life, perhaps when the child is maybe in primary school, the child comes down with maybe chickenpox, measles, and then the parents wonder. I thought this girl, this son of ours was vaccinated when he was quite young. What's happening?
Okay, thank you very much. So, earlier on I told you that vaccine won't prevent the disease. That's one. And it can also, if that disease now eventually happens, it makes the severity, it makes it to be mild.
Okay.
So that's it. So when a child that is fully vaccinated comes down with measles, the severity in that child will be, in fact, the measles will be very mild. It won't be severe compared to a child that is not vaccinated at all.